Welcome to Learn Medical Spanish. Today I'll go over a psychiatric review of systems, some additional questions you could ask to kind of get into the psych history of a patient. This is both a podcast and a YouTube video, and it's similar to some of the content in my CME course. So if you want to learn more about the CME course, mainly geared towards emergency room providers, you can find a link in your podcast episode description or the video description on YouTube, or of course on my website. So as usual, I'll be saying the phrase in English first, and then I'll give you a chance to think about the translation, and I'll give you time to say it out loud each time that I say it in Spanish. Here's the first phrase. Are you thinking of hurting yourself? So think about that translation. ¿Está pensando en lastimarse a usted mismo? ¿Está pensando en lastimarse a usted mismo? So, yeah, that's kind of a long phrase, huh? But that makes it really clear. Like, are you thinking of harming yourself? Are you thinking of hurting other people? So overall, this is pretty similar to the previous phrase. It just kind of changes the ending, I think. ¿Está pensando en lastimar a otras personas? ¿Está pensando en lastimar a otras personas? So a quick note about grammar, I guess. You might have noticed it was lastimarse on the first version because it was something they were doing to themselves. So anytime you have that's called a reflexive verb. And a reflexive verb is something where someone's doing something to themselves, and that's where you have that little pronoun tacked on the end. So that's why it's there in the first version, but not in the second version, because in the second version, they're not doing it to themselves, they're doing it to someone else. So then it's just lastimar a otras personas. Are you seeing or hearing things that other people can't see or hear? ¿Está viendo u oyendo cosas que otras personas no pueden ver u oír? ¿Está viendo u oyendo cosas que otras personas no pueden ver u oír? So that's another long one, kind of tricky. So if you want to see the written version, if you're on the podcast and you want to see the written version, then head over to either YouTube or my website. There's some links in your episode description. And by the way, the reason it says u oyendo and u oír is because the word or, which is o, this is just the letter o, it changes to a u if the next word starts with an O, because otherwise it would be like o, oyendo, o, oír. So you can't even tell there's another, it's kind of like you can't tell that there's the words even there because it's just o. And so it goes o if if the next word starts with an O. So another little grammar note for you. Do you feel very depressed? ¿Se siente muy deprimido? ¿Se siente muy deprimido? Do you feel like you have lots of energy? ¿Se siente con mucha energía? ¿Se siente con mucha energía? So there we're getting into bipolar disorder, right? Like, are you depressed or do you have like tons of energy? Have you ever been sent to a mental hospital? ¿Le han mandado alguna vez a un hospital mental? ¿Le han mandado alguna vez a un hospital mental? Do you have or have you had? So this will introduce the next few phrases. Do you have or have you had? ¿Tiene o ha tenido? ¿Tiene o ha tenido? So that phrase is actually shorter in Spanish because if you're saying do you have, you can just use one word, which is tiene. And that's, of course, the usted form as opposed to the tú form, which would be tienes. But most of the time you'd talk to patients in the usted form. ¿Tiene o ha tenido? Schizophrenia. Esquizofrenia. Esquizofrenia. So it sounds, and it's actually even spelled pretty similar to English, but then you just got to use the correct vowel sounds and slightly different consonant sounds. Bipolar or bipolar disorder. Bipolaridad. Bipolaridad. So that sounds like bipolarity, so which is obviously not how we say it in English, but in Spanish, that's how they would typically say it. Depression. Depresión. Depresión. Another psychiatric illness. Otra enfermedad psiquiátrica. Otra enfermedad psiquiátrica. Thanks for checking out that dialogue. I have a bunch more on the podcast and on my YouTube channel. If you're on YouTube, there's a playlist there that you can see with stuff for ER providers, other videos, dialogues, and a video also that explains my CME course in more detail. And there's some other resources linked to in the podcast episode description or the video description. So thanks for listening, and I'll see you next time on Learn Medical Spanish.